All right, everyone. I need you to step back, please. Let's give them some room to breathe. Thank you. Promise we're going to take good care of them. Hi there, sweetheart. Can you hear me? My name's Ember. I'm a paramedic. You're in good hands now. We're going to take care of you, but I need you to do something very important for me. Stay as still as you can, all right? Especially your head and neck. Don't try to move, even if you're feeling uncomfortable. Did you see what happened? They went over the handlebars. Okay, thank you. That is helpful to know. All right, darling, I know this is scary, but I'm right here with you. Let's start with something simple. Can you tell me your name? That's good. Now, do you know what day it is? It's okay if you're feeling a little fuzzy. That's normal after a fall like this. You're doing great, though. Looks like we've got a head injury here, possible concussion. There could be other injuries from the fall. Casey, I'm going to need the backboard and the cervical collar. Let me grab your vitals first, honey. 2's at 96. Okay, let's check your pulse. Pulse is elevated, 110 beats per minute. It's expected after an accident like this. Blood pressure is 140/90. Elevated, but we're holding steady. Folks, I need you to give us space, please. This is a serious situation, and we need some space to work here. Appreciate your cooperation. Okay, sweetheart. I'm gonna put this collar around your neck to keep it stable. It might feel a little tight, but it's very important. There we go. Nice and snug. Yeah. You're being so brave. Now, we're going to roll you gently onto a backboard so we can move you safely. You'll feel a few hands on you, but I'll guide you through it. Casey, I've got their head. You stabilize the legs. On my count. 1, 2, 3. Nice and easy. Good. Secure those straps. Perfect. Let's get them onto the stretcher. You're doing so well, sweetheart. Just keep focusing on your breathing, okay? In through your nose, out through your mouth. That's it. We're going to get you to the hospital where they're going to take great care of you, okay? All right, darling. Now that we're in the ambulance, I'm going to hook you up to a monitor to keep a close eye on your vitals. This will help us make sure you're staying stable on the way to the hospital for us, okay? All right. I'm just wrapping the blood pressure cuff around your arm again. This little clip goes on your finger. That'll keep an eye on your oxygen levels for me. I'm going to place a few stickers on your chest to monitor your heart. Might feel a little cold, but it won't hurt. Okay, let's see. BP is now 138/88. Still a little high, but holding steady. Heart rate is 105, slightly lower than before. O2 is 97. Everything's looking stable for now, sweetheart. Vitals are stable. I'll proceed with continuous monitoring until we arrive. All right, darling. Now that I've got you all hooked up there, I'm going to look you over from head to toe. This is really important, so I need you to stay as still as you can for me, okay? No moving. Even if you're feeling uncomfortable, it's critical you trust me and hold still. Think you can do that for me? No, sweetheart, hey, it's really important that you don't move right now. I know it's hard. Staying still is the best thing you can do for yourself. Okay? There we go, good. Let's start with your head. You're going to feel my hands on your scalp here. Just checking for any bumps or bleeding. Okay, just keep looking right here for me. Good. I'm I'm going to shine my light in your eyes now. Ready? And keep them open, please, honey. And thanks. Your pupils are a little sluggish, but reactive. That's all right. Probably just means you hit your head pretty hard. Can you tell me, are you hearing any ringing in your ears? I'm going to take a look. No blood or fluid in the ears. That's a good sign. Now I'm going to feel around your neck. Tell me if anything hurts. No major swelling or fractures that I can feel, but we're keeping the collar on just to be safe. I'm going to listen to your chest now. Shh, 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 shh. It's okay. Take a deep breath in for me. And out. Good. Again. In. And out. One more, please. In. And out. Your lungs sound clear on one side, but the other's a bit quieter. Could be from the fall. Maybe you bruised or fractured some ribs. Let's keep an eye on that. Not hearing any air leakage, so that's a relief. Heart is nice and steady, though understandably fast. I'm going to feel around those ribs now, okay? Okay. Here, yeah. Tenderness on the left side. Might be some fractures. Okay. Now, can you squeeze my fingers for me? Good. Strong grip on the right. Can you try that again for me, please? One more time. Okay. A little weaker on the left there, but it's okay. We'll figure it out. I'm going to gently press on your belly. Tell me if anything feels tender. Here? Here? All right. Little tenderness on the lower left here. That could be bruising or something more. We'll get the doctors at the hospital to take a good look at that for you, okay, sweetheart? Next, can you wiggle your toes for me, just like you did with your fingers? That's your left one, honey. Can you wiggle both? Can you wiggle the toes on both feet, please? Okay. I'm seeing movement on the right. Are you not able to wiggle the ones on your left? Can you try for me? No movement there. Okay. And your ankle's looking swollen. I'm going to take a closer look at that now. You hold tight for me, okay? All right, sweetheart. Checking here for any obvious breaks. Please let me know if you feel any sharp pain. Okay, this spot here. I can see some swelling and tenderness. It's looking like a bad sprain or a possible fracture. I'm going to stabilize it with a splint to keep it from moving. Now, you might feel a little pressure as I wrap this, but it'll keep your ankle safe and prevent any more pain. Here we go. Nice and snug. You're doing such a good job staying still. I know it's not easy right now. There we go. That's perfect. So we'll keep everything stable till we get to the hospital. Thank you for being so brave. Now, I know you're in pain, sweetheart, so I'm going to give you something to help. You're going to feel a little pinch in your arm, and then it'll start to ease up. And there we go. You're doing amazing. Okay. Head trauma with possible concussion, left side rib fractures or bruising, abdominal tenderness, left side extremity weakness, swollen ankle, heart rate and blood pressure elevated. Central Hospital. This is Medic 12 en route. ETA 8 minutes. I'm with a patient who fell off a bike at a high speed and hit their head. Patient presents with head trauma and suspected concussion. GCS 13, brief LOC, confusion. Exam reveals left side rib fractures with reduced respiratory effort, upper left abdominal tenderness, concern for potential internal injury, left-sided extremity weakness, spinal precautions already in place, left ankle swollen, likely a fracture or a severe sprain, distal pulse is intact, have a heart rate of 112, blood pressure 148/94, respirations 22, an O2 is holding steady at 96 on room air. IV access established with a 20 gauge in the right AC, NS at KVO. The patient is immobilized on a longboard with a C collar. Please advise if additional interventions are required before arrival. 10-4. Almost there, darling. Just keep focusing on my voice and your breathing. In through your nose and out through your mouth. You're safe now. We're going to get you the care you need. You're so strong, all right? Just hang in there a little bit longer. No. No napping, though. Gotta stay awake with me till we arrive. Look at me. Yeah. Yep. You can squeeze my hand if you need to, honey. There we go. Almost there.